So we'll begin by showing the cancer involving the lung, and you can see that there is extensive, and we're going to stay at this low power to show you the extensive vascular and lymphatic invasion of this lung tissue. As you can see, there's a surrounding normal lung tissue, and surrounding this normal lung tissue is extensive metastatic carcinoma involving vascular and lymphatic channels, very widespread. As I continue, we'll show you the tumor up close in some of the other images, but you can see that it has that glandular feel, it has a papillary feel, a feel to it. It also has a neuroendocrine as I go lower to show you the ultimately the neuroendocrine features with the nuclei, of the nucleus rather. So what I want to do is continue to kind of give you a gestalt of just how extensive this tumor is in the lung and extensively involving lymphatic and vascular channels as I continue to peruse around to give you the gestalt of it all. And you can see the various patterns again. I mean, this cancer is cancer. Let me just take a look, go down just to show you some of this stuff before, because otherwise you'll see that it's going to be very, very widespread. Okay, and I was going to talk about the neuroendocrine features. Look at the nuclei. They're very hyperchromatic. They're irregular. They have this pycnotic nuclei, and it's salt and pepper chromatin pattern. So that's what we see with neuroendocrine tumors. But at the same time, some of as I pass around, you're going to see that some of these carcinoma cells have mucus droplets in them. They're forming glands, like a hint of glands anyway. And and as I continue to go around, but let me go back, because we get caught up as pathologists about the histology pattern, but at the end of the day, it doesn't change the fact that this tumor is really widespread and very aggressive, very aggressive. So I'm not going to belittle the point. I think you see what I'm seeing with the extensive vascular spread and permeation as I go in and out of focus. And that's what we do in pathology when we're showing microscopic image. Let me go to the next slide real quickly. We're going to go real quickly because I think I've shown you quite a bit already as I continue to add more cases. Let me see what slide this is, showing more carcinoma around the bronchus here as I put the slide on here. Again, we're going to stay on low power and scan around. This is all fatty tissue around the bronchus, and more tumor here. Very extensive tumor here. Let me see. And look at the pattern of scarring and old blood. So the person never mentioned anything about hemoptysis, but of course you can't always see coughing up blood. Sometimes it's so minute, microscopic that you can't see it. But obviously there are some old hemorrhage in this lung, scarring, fibrosis. There's a lymphoid response, and this is around the bronchus again, where I took this section from. As I continue to go around, just to kind of give you an idea just how pretty intense this cancer is. And it's going to start, again, seeming monotonous about what I'm saying, because the story is the same. Very widespread aggressive tumor. And again, this is around the bronchus. I'm going to go to the next slide. This slide is more variety pattern of cancer in the lungs. So it's, again, same thing. And you can see it spreading along the pleura, as this tumor was also in the chest wall. If you look at the correlative gross video, as I continue to scan around. Very widespread tumor here. And again, the image is going to go in and out of focus, because this is real-time viewing of pathology. Look at that. All around blood vessels, cancer, all cancer. Various patterns, again, some micropapillary pattern there. More cancer in a lymphatic. Okay, so let me go to the next. Look at that. That's really into a vascular channel there. This is tumor involving the heart muscle, the myocardium. And I'll show you when I see the cancer come in view. There it is. So look at the cancer all in the heart muscle or around the vessels of the muscle there. And I can go down just to confirm to you that that's not lymphocyte. That is indeed cancer around lymphatics of the heart. And it's all myocardium. That's normal myocardium there. More cancer around lymphatic and vascular channels of the heart, deeply in the heart muscle. We're going to go to the next slide. And I'm going to start speeding it up. This is cancer around a coronary artery. That's all tumor. And let me show you where we are so you can see that we are indeed in a coronary artery, or near a coronary artery. As I scan around, you can see the cancer all around the fat. Here's the coronary artery here. It had moderate atherosclerotic changes in it. So there is some vascular plaque disease, but you can see the cancer all over or surrounding that heart, that coronary artery. And this is cancer right here. And that's in focus for you. Extensive cancer. So I go to another slide. More cancer around the coronary artery. Let me see if I can get it in focus. So that's the artery there with some extensive calcification, atherosclerotic changes, but you can see more cancer there around. And as I give you here's the artery here, and there's more cancer around it. So this was extensive cancer around the heart, coronary artery. And here is cancer around the big artery that comes off the aorta. Okay, that's the cancer. And here's what we call a muscular artery. It's called aorta. And there's some plaque disease in an aorta. And there's the cancer around it. Okay, going to the next slide. Here's more cancer. Let me see what slide this does. More widespread cancer. Just to kind of give you this thing was really very overwhelming to the system of this person's body. All cancer. And that's in fibrofatty tissue. Okay? That's all cancer. And here is more cancer in the heart. There is fibrofatty tissue around the heart, very hemorrhagic with tumor in it. And then let me show you that this is heart tissue. There's heart muscle. And there's the cancer around the epicardium or pericardium actually of the heart. Fibrofatty tissue around the heart. More cancer. Very extensive widespread cancer involving the heart and soft tissue around the heart. And here is liver. That's normal liver there. And then look at the cancer comes right up to it. Or well, actually it's in the liver. And I'll go down to show you more of this, but I just want to kind of peruse around so you can see just how extensive this cancer was. There's more cancer and lymphatic of liver tissue. Very widespread cancer. That's more cancer. I go down just to confirm to you that is indeed cancer in the liver tissue. Metastatic